Ascension St. Agnes is a 160-year-old hospital, Catholic hospital, that was started by the Daughters of Charity in Baltimore, and has really served this community that is a wonderful mix of population of people who are at different ends of the socioeconomic spectrum, always trying to be there as a community hospital. So the Chaperone program is an extra level of care for our regular ride-sharing programs. And it's really built in to make sure that this vulnerable population, many of whom don't have access to transportation, are able to get assistance in getting from their house sometimes down to the vehicle, getting in the vehicle, and then getting out of the vehicle when they get to their place where they're going to receive care.
Southwest Baltimore is known to have a number of transportation issues that has really impacted its livability. Having this program, we have been able to support patients to get to their appointments and get healthy. And when they're healthy, they can go back to their community, be really great participating members of their community.
Most of them have chronic conditions that they are having to navigate. They may have other things that are really set against them and make life hard.
I mean, in some cases, I think we have a patient that missed over 20 of her wound care appointments, are now coming to their appointments on a regular basis with that chaperone. They feel safe and they feel supported, and that's really what's important to us.
One of the things we found was that patients' holistic health care does not only encompass health. There are what we call social determinants of health. We're talking about things such as food, things such as transportation, interestingly, where the chaperone program falls under.
For someone older to get with a walker from the main entrance all the way to like the lab is it's almost undoable. So I'll ask if they would like a ride, and a lot of times they'll say yes, and we can accommodate them, a family member, an assistive device, whatever it is, drive them to where they need to go, and even can help them get to their appointment.
The impact of the community is the improved health quality for the individuals, which we think is how you measure the health of a community, is making sure that each individual is healthy, has access to care, is getting the things that they need.
The Community Challenge Grant has been incredible in helping us bolster the volunteer portion of our chaperone program. Really selling our program to volunteers and connecting volunteers back to our hospital to be part of this program.
We had volunteers in the midst of the pandemic when nobody wanted to volunteer in person. We had support from students from colleges just to wanted to help at that time.
You know, rising tides lift all boats, and that the reason that we are able to lift people's souls is because we can give them something that they don't have now, which is a sense of peace and security. And that for seniors is invaluable.